Hello everybody, this is TJ Smith and I'll be showing you how to administer an intradermal injection. So the things you'll need to know is you can't drop more than half an ml. Gauge size is between 25 to 27 gauge. Needle size is 1/4 to 1/2 inch. And you'll be going at a 5 to 15 degree angle. So to begin, you'll gather your supplies, know the actions, check the date of the drug, make sure it's not expired or anything like that. Know your 3 checks. I do my 3rd check at the bedside, and know your 11 rides of medication. So I got my supplies gathered. I'm going to approach the room and the patient. I'm going to perform hand hygiene, check the ID band, do at least 2 patient identifiers, name and date of birth, and then check the MRN number. Ask the patient if they have any allergies, if they're allergic to anything. They don't seem to be, or they stated they're not allergic. So to begin, I'm going to know what sites to administer this intradermal injection. So you'll have your inner forearms and then your lower back below your scapula. So those are your sites. I'm going to administer it in the forearm, and then I'm going to don my gloves. So got my supplies here. So before I don my gloves, I'm going to get this alcohol pad, circular motion at the site and on top of the vial. Okay. So I got my gloves on, and I'm going to get my needle. So today I got me a 26 gauge needle. I got my med here. I'm going to take the cap off. And the order says 0.3 mLs to be injected. So I'm going to drop 0.3 mLs of this medication. Alright, make sure I don't have any air. Okay. So I'm gonna make sure this bevel goes up when I go to inject. So I'm at the forearm, and I'm gonna inject at a 5 to 15 degree angle, and then I'm gonna inject slowly. Okay. So you got your little wheel there. I'm gonna trigger my safety action on my needle. Today I'm gonna recap it because I wanna keep my needle. Dispose of that in the sharps container. And I'm going to discard this medication properly if I have any excess left, because I don't want to leave any medications at the bedside. I'm going to practice my general principles and safety practices and put the patient back in a comfortable position if I have to reposition them. Make sure their call-out's within reach. And then I'm going to doff my gloves, throw them away. Got the needle in the sharps container. Got my medication with me, going to discard of it and perform hand hygiene when I'm walking out. And I'm going to document, record what I just did. And I'm going to come back and check the patient's response to the medication, checking about an hour or 2 depending on the medication, and make sure there's no adverse effects that are present. And then reposition if I need to, and then exit the room, perform hand hygiene, and that's how you administer an intradermal injection.